No, I still can't.
I think we're going to start, Lorraine. Is that okay?
Yeah, it's fine.
Liesl, are we okay to start?
Yes.
I'm Elizabeth Dardnell, the Executive Director
Mon
of the
nom est
Sexual
Elisabeth
Violence
Dardnell,
Research
je suis la directrice exécutive des...
On behalf of the SVRI and the IRC, I am honoured to formally launch and welcome you all to the SVRI and IRC Learning Webinar series, Building Bridges and Advancing Learning on Violence Against Women and Violence Against Children Intersections. Today's webinar is the first of 3 webinars.
Alors, ce webinaire d'aujourd'hui, c'est une série de 3 webinaires qu'on va avoir.
The key event in our field where we come together to share what's working.
Alors, quand on va avec vous, on va explorer avec vous les différentes... Alors, c'est célébrer les succès.
Forum 2022 will be held in Mexico, 19th to the 23rd of September. And there will be many, many people from different fields and disciplines, sectors that will attend the forum, including
from the différents secteurs qui ont fait et qui ont entré à travers nous.
Which is why we thought a webinar series on the intersections between violence against women and violence against children should be helpful to help feed into the discussions on the issue at the forum, and of course to invite you all to attend. Lisa, would you mind just sharing the chat of the forum link into the chat? Violence in various forms is an everyday reality of many children and women in all countries of the world. Violence, particularly family violence, can have profound and long-lasting consequences. Research is essential to learn how to effectively program for and prevent the multiple forms of violence children and women experience throughout their lives. Evidence tells us that some of the risk factors for violence against children and violence against women are the same, and that integrated programming that work to address these shared risk factors and address violence against women and violence against children where it occurs can be very, very effective. So through this webinar series, we are going to discuss the current evidence on the shared drivers of violence against women and violence against children. We're going to showcase a field-tested program approach to addressing co-occurring intimate partner violence and child maltreatment, and also provide a space where we can together reflect on the challenges and the opportunities for adapting and scaling up programming on violence against women and violence against children intersections. Today's webinar will focus in on the shared drivers and norms of violence against women and violence against children. Just some housekeeping. We are using Zoom, which I know everybody is very, very familiar with. We do have translation services available, which I'm sure you've all heard at the in the opening, and these will share links on how to access the translation services if you're not aware of how to do so. And the webinar is recorded, so we can share the discussions with those unable to join us online today. And welcome to all of you online with us today. So to get us started, we would like you to answer a question for us using Mentimeter. Lisa, the producer for today's event, will paste the question in the chat. And the question is, why is it important for violence against women and violence against children actors to work together? While you're answering that question, I'm going to have the great pleasure to welcome our host, Dr. Daniela Ligero. Daniela is one of the most generous and kind and really incredibly important thinkers in the field. Daniela is the Executive Director and Chief Executive Officer of Together for Girls, which is a global partnership working to end violence against children and adolescents, particularly focusing on ending sexual violence against girls. And recently, Daniela, with a bunch of other amazing people, have launched the Brave movement, really important for the field, a survivor-centered global movement fighting to end child sexual violence. So please, we've shared the links to both Together for Girls and the Brave movement. I encourage you to go look at that and join the Brave movement. Over to you, Daniela, to introduce the panel. Thank you.
Thank you so much, Liz. It's such an honor to be with you all here today. Good morning, good afternoon, good evening. I don't think I've ever been introduced officially as kind and generous, and it just really touched my heart. And I think that's just what I look around the room and see all around me. Everyone here is really trying to do their best to create a safer and better world for women and for children. And I think that requires a lot of generosity and kindness. So I'm really thrilled to be with you here today. So the way it's going to work is we're going to have a first panel with a presentation, and then we're going to have a second panel with some Q&A, and then we're going to open it up for the audience. I do encourage you though, because there is kind of a presentation that's amazing with lots of different speakers coming. Please, please, please put questions, thoughts, ideas in the chat. As much as possible, we're going to have a few people who are going to try to respond to some of those questions along the way. And then for other items, we're going to leave them till the end and try to open it up so that we can address some of those. But I do encourage you to use the chat as much as possible and put forward ideas and questions. And there will be a few folks who will be keeping an eye on that and trying to respond and connect with you. So with that, it is my great honor to introduce our panel. The first panelist is Alessandra Guedes. Alessandra is the manager for Gender and Development Research at the UNICEF Center for Research Innocenti, where she leads the development and implementation of a research program to address key issues and constraints to achieving gender equity within child protection, with a particular focus on addressing the interlinkages between violence against children and violence against women, the focus of our event today. Isabel Pearson is a PhD student at the London School of Hygiene and Tropical Medicine, focused on the intersections between violence against women and violence against children. Again, there are several folks here who really focus in specifically on this issue. Manuela Colombini. Dr. Colombini is an associate professor in health systems and policy at the London School, focusing on health system strengthening, sexual reproductive health, gender and violence against women and girls. Lorraine Bacchus, finally. Dr. Bacchus is an associate professor of social science at the London School, focusing on the development and evaluation of health system interventions that address violence against women and against men in same-sex relationships. So over to our amazing panel for their presentation.
Thanks so much, Daniela, and hi, everybody. It's a pleasure to be here today, and find it interesting that I don't think that a couple of years ago you would have found so many of us who are interested on these intersections. So it's really nice to be surrounded by folks with similar interests and also see the field growing. I will be presenting today with some amazing women that you've met from the London School of Hygiene and Tropical Medicine. And we will be sharing with you some emerging evidence from 2 systematic reviews, including one that has not been published yet. And just so you know, when you receive the slides, we've embedded links throughout
des violences
the slides.
Contre les femmes et les enfants. Alors,
let's see if we can get the French. There we go.
Alors, je ne sais pas si on peut avoir le français.
Sorry, Alessandra, give me a second. I think there's a second device.
Voilà.
Second device that came in, so I just want to.
Alors, je pense qu'il y a une deuxième voix qui vient d'entrer. Alors, je vais essayer de la couper et de traiter.
I think we're okay.
Excusez-moi, vous êtes en train de couper le micro. Vous êtes en train de couper le micro de l'interprète, s'il vous plaît. Est-ce qu'on peut me donner les boutons d'interprète, s'il vous plaît? Je vois que je suis en train de me faire couper, si c'est possible.
Okay, I've just temporarily muted. Let me just try. You can go ahead, Alessandra.
Okay. Yeah. So just so you know, we've embedded links throughout the slides so that you can follow up for more details after the webinar, because there's a lot of information that I think you might be interested in. And so before we dive into the findings, we thought that it would be helpful to contextualize this conversation, starting by examining some of the reasons of why the fields of violence against women and violence against children have evolved in this so-called parallel and separate ways. Next slide, please. So those of us who've been in this field for a while will say that the fields of violence against children and violence against women have grown considerably within the last decades, but they still remain relatively new areas of work. And although there have been some important investments recently, violence prevention really remains drastically underfunded compared to other areas. And I think particularly when one considers how prevalent violence is. I think we have again the French translation coming through. Yeah, let's try again. So we're in slide 2, and we're talking about why these fields have grown in such separate ways. And I think one of the things for us to remember is that these are very political areas of work. I think sometimes we forget that, but perhaps women's rights being particularly vulnerable to changing political landscapes, to rising authoritarianism, and so forth. These are areas that are also led by individuals who are very passionate about their work. And I think while our passion has been necessary to get these issues the recognition that they deserve, they have also made it difficult for us sometimes to compromise and to collaborate. For instance, while the field of violence against women is centered around the idea of empowering women, those working on violence against children focus primarily on protecting children from harm. And at times these goals may seem to be at odds. And so these characteristics have led to the development of separate programs, policies, laws, research, and constituencies. At the same time, with the availability of more and better evidence, it has become really clear that we must look for opportunities to coordinate and collaborate. Next slide, please. So a couple of years ago, I co-authored a paper, a global review on the intersections of violence against children and violence against women with Sarah Bott, Claudia Garcia Moreno, and Manuela Colombini, from whom you will hear in a bit. And we identified 6 ways in which these forms of violence intersected. As Liz mentioned in the beginning, first of all, there are many shared risk factors that are associated with the perpetration of both violence against women and violence against children, ranging from gender inequality to a lack of responsive institutions, really across the socio-ecological model. And harmful social norms, harmful gender norms are a key shared factor across these forms of violence. We know, for example, that worldwide norms that condone violence and prioritize family reputation over victims' rights and needs increase the risk of both violence against children and violence against women, and also serve as barriers to help seeking by victims. So it's not surprising, perhaps, that we find that these forms of violence tend to occur in the same household, in the same families. We know also that evidence shows that both violence against women and violence against children lead to multiple intergenerational effects. For instance, we find a strong and consistent association between early exposure to violence and the risk of experiencing or perpetrating violence during adolescence and adulthood. And finally, we talk over and over again about the fact that even though adolescence falls sort of in between these two fields, it often gets overlooked by both fields. So we focus on adolescence as an area of particular focus. Next slide, please. So about 3 years ago, when I joined UNICEF, we embarked in this process of outlining the rationale for why and how the organization's work on violence against children could be more responsive to the gender dimensions of violence, including specifically the intersections between these forms of violence. And through extensive consultation, we produced the discussion paper, which you see on your screen, which reviewed the evidence and suggested ways forward, primarily for UNICEF, but not only. And the work that I lead now at the Office of Research Innocenti is guided by this paper and seeks to strengthen our response to the gender dimensions against violence, to the gender dimensions of violence against girls, boys, and women. Next, please. So with the goal of supporting not only UNICEF's work on violence prevention, but also the field more broadly, we're working to produce evidence on gender transformative approaches to violence prevention with a focus on these intersections. We're exploring emerging issues for UNICEF, including technology-facilitated violence And we're working with partners like the London School of Hygiene, like the SVRI, to strengthen networks and capacities for generating and using this evidence. Next, please. So in advancing the availability of knowledge, we have focused on answering questions such as how violence against children and violence against women intersect. What are the implications of these intersections for policy and practice? What are the priorities for research on violence against children and violence against women, which is something we're working with WHO and SVRI on. And the 2 systematic reviews that you will hear about today, and I've highlighted them in blue on your slide, they are helping us answer these questions and more. So now I'm going to pass it on to Isabel, who's going to share the findings from the first of these 2 systematic reviews. Over to you, Isabel.
Thank you so much, Alessandra, and thank you for everyone for joining the webinar today. Yeah, can we go to the next slide, please? Okay, so I'm going to be presenting the results of our systematic review on the risk factors for co-occurring intimate partner violence and violence against children. Next slide, please. So this systematic review aimed to identify and synthesize research on co-occurring intimate partner violence and violence against children. And we aim to identify individual, social, and environmental risk factors associated with this co-occurring violence. Our setting for this study was low and middle income countries. We originally planned it to be global until we found an existing review that covered high income countries well. So as to not duplicate efforts, we limited ours to low and middle income countries. And I can post that review for you in the comments afterwards. Next slide, please. So just quickly, our search was conducted from January 2000 up until February 2021. We screened just over 6,500 abstracts and resulted in 33 studies for inclusion, covering 25 countries. Next slide, please. So the definitions we use for the types of violence are as follows. The violence against children had to have occurred before the child was 18, where the perpetrator of violence was either parent or caregiver. Then the co-occurring partner violence had to have been perpetrated by or against one of the child's parents or caregivers, either in the past year or by the current or most recent partner. And we also included studies where the child may report both experiencing violence from their parents and also witnessing intimate partner violence at home. And we took them witnessing intimate partner violence as evidence of it occurring, the IPV occurring, but we did not include children witnessing IPV as a form of child maltreatment itself in this study. So initially we aimed to look for studies that identified risk factors for violence against children and IPV occurring together, as can be shown here by the pink arrows outside of the blue circle. But actually we only found 3 studies which looked at these risk factors and their association with co-occurring violence, where the co-occurring violence was measured as one combined outcome. The majority of studies that we identified in our search actually measured the association between violence against children and IPV when they were occurring together. And these studies were investigating one type of violence as a potential risk factor for the other, as shown here by the double-headed pink arrow within the circle. And we found 30 of these studies. It's also important to note that all but one of them were cross-sectional, and therefore we don't have the temporal element as evidence for the hypothesized risk factors. So to summarize, we were looking for studies that investigated external risk factors for co-occurring violence against children and IPV, or studies that investigated one type of violence as a risk factor for the other when they were both occurring at the same time within the same families. Next slide, please. So if we start with the results of those 30 studies that measured the association between IPV and violence against children. So within these, we found multiple types of co-occurring violence. So the most commonly measured type was where male to female IPV was co-occurring with female caregivers' use of violence against their children, as shown by the diagram in the top left here, of which there were 16 studies. Second was where IPV was male to female, but the perpetrator of violence towards the child was unspecified, of which there were 7 studies, and so on. And you can see the 6 subgroups here that we identified based on the specified perpetrator of both violence types. And of course, sometimes it wasn't specified for either, and this was the case for 8 studies shown at the end here. So due to the heterogeneity of the studies, we were very limited in the meta-analyses that we could perform. as the studies were often just not similar enough to compare. So we were able to conduct a meta-analysis and calculate pooled odds ratios for 2 of the co-occurrence subgroups. And from this, we found that in both groups, IPV was significantly associated with the co-occurring violence against children. So what this means is that in families where violence against children was reported, intimate partner violence was more likely to be reported than in families where violence against children wasn't reported. And in terms of studies that we could not include in the meta-analysis, the overwhelming majority of these studies found that IPV was significantly associated with co-occurring violence against children. Next slide, please. So for the 3 studies that did look at these associated hypothesized risk factors with the co-occurrence of these 2 types of violence as the outcome, the first was conducted by Carlson et al. In Uganda. And this study showed that females' higher education and female caregivers' emotional attachment to their intimate partner protected against co-occurring violence. This study also found that male caregivers' attitudes against violence against children and male caregivers' emotional attachment to their intimate partner were also protective. Next slide, please. And then for the 2 studies in Brazil, we can see that in the first study, caregiver companions' education level and the presence of children under 5 years old protected against co-occurring violence, whereas older maternal age, caregiver misuse of alcohol and or drugs were risk factors for co-occurrence. And here the sample was in pregnant women specifically. And in the second study, which was the 1 longitudinal study that we identified, the absence of the child's father, paternal antisocial behavior, neighborhood violence, level of criticism in the relationship, maternal depression, and younger maternal age were risk factors for co-occurring violence. So overall, these 3 studies presented mixed and sometimes contradictory results. And of course, with just 3 studies, it's not really possible to generalize the results. However, in this review, we have found that there was strong evidence for an association between the 2 types of violence when co-occurring together. And therefore, any known risk factor for one type of violence could therefore be an indirect risk factor for the other. Next slide, please. Okay, so to conclude, there was a lack of research regarding men's use of violent parenting, as was shown by an overrepresentation of female perpetrated violence against children in our review, which could reflect existing biases and assumptions around male versus female parenting roles. And we thought it was very interesting that most often only the female caregivers were asked about their parenting, despite the male caregivers being asked more frequently about IPV. And the influence of female caregiving responsibilities, such as time spent with their children, wasn't considered in the analyses as a potential confounder by the individual studies. And regarding our understanding of co-occurring violence, we feel it's important to consider all family members and their use of violence if we want to understand the dynamics of the household as a whole. Further, we found that there were lots of different definitions used to define the violence types. And there was a lot of overlap of terms used throughout the literature, such as physical violence, harsh parenting, parental cruelty, etc. But what's perhaps more important, or at least more interesting, are the different types of violence that the studies included in their definitions, as there were a broad spectrum of abuses included. For example, some definitions of violence against children included shouting at the child as a form of violence, and other considered only physical violence, for example. Also, some studies used measures for violence that incorporated the frequency or the severity of the violence, and some didn't, meaning that it was really hard for us to draw conclusions across studies. So I think it's important for us to consider different types of violence and how we define these outcomes across settings and across different social contexts. And finally, there was obviously a lack of longitudinal data in the included studies, and therefore we can only really make predictions to what might be risk factors for co-occurrence, as we only found one longitudinal study. So I'll stop there. Sorry, that's quite brief. The paper is published if you'd like to read it in more depth. But thank you for listening, and happy to answer any questions. And I'll pass on now, I think, to Manuela, who's going to talk through the next review.
Thank you, Isabella, and hello, everybody, and really happy to be here. So I'm going to talk about the second review on effective intervention that seek to respond to intimate partner violence against women and child maltreatment. Next slide. Together with Innocenti and Alessandra, we conducted a rapid systematic review to identify effective intervention that seek to prevent and respond to intimate partner violence and child maltreatment by parents and caregiver. So in this review, we focus specifically on forms of child maltreatment by a parent and caregiver, including the use of violence to discipline children, or often referred to as harsh punishment or violent discipline. And this is how we define child maltreatment. And we actually look at the global settings, so high income and low and middle income settings. Next, please. So just to focus here, you can see our kind of timeline, and we identify 28 studies covering 25 unique interventions from 15 countries. Next, please. We categorize our findings by prevention, primary prevention intervention, so before the violence occurred, and response intervention. So of the 17 primary prevention intervention, the most common ones were community-based and parenting programs, and mainly were implemented in low and middle income settings. So the 6 community-based interventions focused primarily, were designed to address IPV, and content focus on addressing harmful gender norms and power dynamics and gender inequity, and building effective communication skills for problem solving in relationship. So for the 8 parenting program, the focus was primarily on reducing the use of harsh punishment or violent discipline toward children, and developing a more positive relationship between the caregiver, parent, and the child. We then looked at 2 school-based programs and 1 cash transfer, and both focused primarily on changing harmful social norms and attitudes toward gender and violence against women. Next, please. So some of the key main findings from this set of these categories of prevention intervention. So our findings showed reduction of both intimate partner violence and child maltreatment across the studies, apart from the cash transfer ones. So the community couple-based programs saw a reduction in intimate partner violence and children witnessing IPV at home, and also reduction in violent discipline and in acceptability of IPV. The parenting programs also show some promise to prevent harsh parenting practices and promote more gender equitable norms that could actually indirectly lead to also reduce the IPV, and through the increase in kind of more awareness of harmful also effect of violence on children. The 2 school-based ones saw a reduction in violence discipline at home, and also reporting of reduction of children exposure to IPV, and a reduction in emotional partner violence that were reported by the women, by the mothers, and an increase in kind of more positive gender equitable attitudes. While our cash transfer program, the one we included, actually didn't have any effect on IPV or violent discipline, and nor on any changing social norms. But just to kind of worth noting here that actually 2 of our parenting programs also had a kind of component on cash transfer. And these kind of combined programs show some reduction on IPV and child maltreatment. So showing some potential for this kind of combined cash transfer and parenting programs to impact simultaneously on both forms of violence. Next one, please. So, and these are our 8 response intervention, all from high-income countries. And we identified 4 interventions that were working with mother and children. They were psychotherapeutic treatment. They were primarily focusing on parenting after violence and improving psychosocial well-being of both the mother and the child. And we had 2 interventions that were primarily working on training healthcare providers to improve their knowledge on safeguarding, on child safeguarding in the context of intimate partner violence, and also of multi-agency work across these 2 different sectors and partners working in the 2 forms of violence. And then lastly, we had 2 interventions that were targeting IPV male perpetrators. And these interventions focus primarily on regulating emotions, and restoring the father and child relationship and reducing violence against women. So next slides, please. Just briefly to give you the key findings for this type of intervention. So we saw reduction in intimate partner violence and decrease of frequency and severity of the mother and the children exposure to physical and psychological partner violence, for specifically for new and a new current relationship, and reduction in use of violent discipline by the mothers, and improved mental health of both mother and children, which is critical, and Lorraine will talk a little bit later in this next slides. In terms of healthcare provider training, we actually show results. Oh, sorry, can you go back to the slide? Thank you. So we show changes and improvement in the knowledge of the providers in understanding the link between IPV and child safeguarding, and some of the processes for working across multi-sectors. And for the male perpetrators, we saw a reduction in men's violence behavior towards spouses, and also changes in their attitudes over violence against women and violence against children. And now I'll let Lorraine continue and focus specifically on pathways for reducing these forms of violence in these interventions. Thank you.
Next slide, please. Thanks, Manuela. So this figure highlights key pathways to the reductions in both forms of violence within the 17 primary prevention interventions. It's very complicated, so I'm just going to distill the key things for you. So you can see on the left-hand side, the boxes show that they focused on one form of violence or the other. In terms of the commonalities, we found that the intervention participants were able to apply the conflict resolution techniques that they learned and the communication skills to both their couple relationship and to the child caregiver relationship as well, and that this led to the reductions in both forms of violence. Also, the other commonality we found is that these interventions help to facilitate men's engagement in shared parenting, and that this helped to promote more equitable and respectful relationships. And in turn, that led to reduced stress and conflict in the home. And again, that would lead to the reductions in the violence. Next slide, please. And sorry, I wanted to apologize. My webcam isn't connecting today, and that's why my video isn't on. So these are the response interventions, and these were far more diverse. And so I'm just going to focus on 4 that were very similar. And these interventions targeted women survivors of IPV and their children. They're all from high-income countries. These were the therapeutic interventions which aim to improve the mental health and well-being of women and children. And they also focused on strengthening the mother-child relationship post-abuse. So in terms of the common elements, the interventions really help women to understand the difference between healthy and unhealthy relationships, which then led to the reductions in intimate partner violence. And they also helped women and children to really engage with their traumatic abuse experiences, and that led to some of the observed improvements in mental health that we saw, such as decreased depression and anxiety, and improvements in self-efficacy. And so women and children were developing more adaptive coping mechanisms. The interventions also provided skills in the use of non-violent discipline, and this again strengthened the parental bond. It led to the reduction in the use of harsh punishment towards children, but also had this knock-on effect in improving children's mental health. Next slide, please. And so here we highlight 4 key elements that we think are important in terms of developing future programs. Firstly, there's a need to have interventions with multiple components so that go beyond change at the individual or couple level, and really recognize the need to engage with the wider community to reinforce and sustain positive outcomes. That they need to create awareness of the adverse health impacts on IPV and violence in general on children, to include critical reflection on the gender norms that drive both forms of violence, and to help couples to develop better communication skills and the use of non-aggressive strategies for addressing conflict in the home. Next slide, please. And finally, these were the evidence gaps that we found. Firstly, we need to understand when it's necessary to have combined interventions and when it's not right to do that. There was a tendency to focus on one type of violence or the other, but it's important when including the other type of violence to include an expert on that type of violence and include them really in the development of content and even the delivery of the training. We found very little evidence on response interventions, particularly in low and middle income countries, and there may be missed opportunities to integrate violence against children responses into some healthcare settings that are already developing response to IPV. Very little programming that targets adolescents, and we know that's a vulnerable period when they may be experiencing violence from a partner, but also forms of child maltreatment. And like Isabel's review, we also found a lack of standardized approaches to the measurement of partner violence and child maltreatment, and also a reliant actually on caregiver reports for harsh punishment, and sometimes relying on men for reports of perpetration of violence. So there's really a need for more corroborating evidence. And now I'm going to hand over to Alessandra.
Next slide, please. And Daniela, I know that we're running out of time, so I'll be very brief. There's a question from Samuel Martin in the chat saying, you know, can we say authoritatively that if we get men to abandon violent discipline of children, that will reduce IPV? I don't think that from this evidence we can say authoritatively that. We're still trying to figure out what all of this means to work on the ground. But what we're saying is we're identifying some of the risk factors that we know to be associated with both forms of violence. So logic would suggest that if we are able to address those risk factors, then we would be able to have an impact on both forms of violence. That's where the second systematic review comes in. The fact that all of the response interventions come from high-income countries is a challenge, right? And so I think it's really important for us to keep in mind these opportunities that we have so that we don't miss them. The over-representation of interventions from the prevention side is not surprising necessarily. We have some other study from the East Asian Pacific region that showed that it's easier for these fields to collaborate on prevention than it is on response. And I think it's also very important for us to keep in mind the biases that we are observing in the literature. As you heard from Isabel, some studies, most studies, don't ask whether men are perpetrating violence against their children. They're asking women. And so we are embedding these biases in the evidence and in the results. So we get this narrative that women who are abused tend to abuse their children more often, which may or may not be the case, but the evidence is not conclusive about that. So I think I will end it there and say a big thanks so that we can open up the conversation. And really great to be here with you. Thank you.
Amazing. Thank you so much. And you're right on time. Amazing. Thank you so much for really a fantastic presentation. So much here to digest. I also noted that there were a lot of questions in the chat that were being answered as we went along. So that's great. Please continue to put those in there. And as much as possible, we're going to have folks trying to respond. So as I mentioned, our next section is going to be a panel with some Q&A and discussion, and then we're going to open it up. And it is my pleasure to introduce the next group of amazing people. First, we have Marcilen Marquisa. Dr. Marquisa is a senior scientist in the Gender Health and Research Unit at the South African Medical Research Council, where her research focuses on the epidemiology and drivers of intimate partner violence and sexual violence, with the focus on intersections with mental health, evaluating the national health sector and criminal justice response to sexual violence, and intervention, development, and evaluation. We also have Paul Bukuluki, Dr. Bukuluki is an associate professor at the Department of Social Work and Social Administration, the School of Social Sciences of Makerere University, where he focuses on gender norms, social norms, sexual reproductive health and rights, and violence against women and girls in development and humanitarian settings, particularly in Africa. And finally, Dr. Lindsey Stark. Dr. Stark is the Associate Dean of Global Programs and the Professor of Public Health at Social Work at Washington University in St. Louis, where she focuses on protection and well-being of women and children in situations of extreme adversity. And she co-directs the Center on Violence and Injury Prevention. Welcome, welcome to our three just absolutely phenomenal panelists. We are delighted that you're here with us today. So I wanted to start, and I just want to say this, hopefully this is a conversation. I'm going to start with a question that's for each of the three of you, and then I'll have some follow-up questions that are really directed more specifically to you. But let's start with kind of a broader, big picture question around what do you think is really needed to bring the fields of violence against women and violence against children closer together around research and programming? And if you have any concrete ideas of how we might do that. We heard from Alessandra that there have been a lot of advancements in terms of doing that within our fields, but what do we need to take that a step further from your perspectives? So who would like to start?
I can go.
Awesome.
Thanks.
Please go ahead, Marcilen.
Yeah. Thanks so much. So I think from my view, there's a lot that we can do that is quite concrete in terms of starting to address the intersections of violence against women and violence against children. And I think the first and most important thing is that we need to start to prioritize evidence-based programming. So basically, we need to move away from programs that are not informed by the evidence and the theory, which is part of what the presenters have been showing us, these intersections. So if we are grounded in terms of how we develop programs, how we intervene in research and in theory, then I think that's a very big step. And I guess another thing that could happen is, as much as there's this acknowledgement about the intersections too, actors at the different levels, whether it is at country level or at local level, to start to continue to collaborate in a way that leverages resources and that maximizes impact. So not working in silos at all levels, not just international level, but at all levels down to the grassroots. I'll take a pause and leave for the others.
Thank you, Marcilen. Am I saying your name right? I'm sorry. Can you correct me?
You're right. Thanks. It's Marcilen. Yeah.
People butcher my name often, and it's I'm used to it. So I always like to check in. Why don't we go ahead and move over to Lindsey? I see your camera's on. Why don't we go ahead to you?
Sure. I agree, Marcilen, with the great points you mentioned. And, having had some of these conversations, from 10 years ago, it really was almost like a dirty word to try to bring these two things together and to try to have a conversation together. And so I will just say that I think there's been so much advancement already in allowing us to find space where we can come together across violence against women and violence against children. And I would say that, you know, one thing that might be helpful is to really recognize where there are these opportunities and where it is right for us to come together and be working on these intersections, and where there is still space and room and important work to be done separately as well. And I think if we can understand where those divergent places are, where it's important to focus on violence against women separately, independently, not only as mothers, and similarly for children, where violence is happening, not, you know, in a way that is not necessarily about caregiving and parenting, that can also be helpful for us to understand where these two things don't have to come together, two parts of the field, and where things can come together in a way that does feel like it's building, like it's helpful, like it's taking some momentum forward, and that it's helpful for both of these distinct and important fields.
Thank you, Lindsey. So I think we heard from Marcilen this idea of kind of being guided by evidence and trying to make sure that that happens at absolutely every level, all the way to the grassroots. And from you, Lindsey, this idea of mapping not only where it makes sense to work together and where it makes sense not to work together, so that we're not forcing ourselves into a situation where we're working together when it doesn't make sense, right? I think that's a really good point as well. Paul, did you want to come in? I see your camera is now on.
Yeah, thank you very much. I think that I agree with my colleagues. First of all, that we need to recognize when we need to work on VAW and VAC separately in different contexts. But we also need to put even more effort, because that is what we have been doing. So we need to put more effort to intentionally make sure that we also understand more how these can be handled together, how we can combine working on violence against women as well as violence against children. And it is extremely important, especially to know the shared risk factors. For example, we know that social norms around the abuse of power or toxic masculinity or hegemonic masculinity really affect both children and they also affect women. So the more we interrogate and find ways of handling and addressing the shared drivers like social norms, the better we can move forward on this front. Thank you.
Thank you, Paul. You know, it's interesting, this idea of the framework and power, I think is so important. And Alessandra made a really interesting comment at the very beginning around how with violence against women, there's perhaps a focus on empowerment of women. And with violence against children, it's around protecting children and not necessarily empowering them. And so really understanding those power dynamics, right? Men's power over women, adults' power over children. There's some kind of basic frameworks there that need to be really dug into. Yeah. So I'm going to move over and ask just a follow-up question. And Marcilen, I'm going to go specifically to you. One of the things we saw in the review is really the focus on kind of interventions within the family as a unit. Can you say a little bit more in terms of your perspectives on what are the benefits of trying to target the family and that space to advance both violence against children and violence against women, as well as the risks of focusing on the family as a unit?
Thanks, Daniela. So I guess the important thing or the benefit of intervening at the family unit is that there is that opportunity that we've been talking about to address both violence against children and violence against women, because it really is, you know, part of the bigger problem of family violence. However, that in itself poses a challenge, because what ends up happening is that in some cases, you are intervening at the same time where you have both the victim and the perpetrator. And that can pose challenges in terms of the safety of the beneficiaries. And therefore,
when people or when programmers are intervening at the family unit, much more, I guess, has to be done in terms of scaffolding and in terms of ensuring the safety of participants. And also perhaps even working closely with response, because what could happen is that there might be a need. For example, you might be working in the area of prevention, but at the same time, you would then need to, if violence is detected or is disclosed, you might even want to start to activate responses, including criminal justice responses. So I think there are both benefits in terms of what you can achieve, but the risks are really around safety of the participants should they be victimized.
Yeah. Yeah, really good points. Let me move over. And again, if anyone wants to jump in, Paul, Lindsey, please do. We're trying to also make this a conversation. So if you have comments on the previous question, please jump in. I did want to kind of, while you're thinking about whether you want to comment on that.
Daniela, do you mind if I jump in?
Please jump in.
I did just want to say one thing as we kind of discuss the idea of family interventions. You know, as a professor who sits on dissertation committees, I have the luxury of hearing from other brilliant minds. And on a dissertation committee last week for Tina Fisher, who some of you may know well from the child protection world, who just finished her dissertation looking basically at family structures in humanitarian contexts in particular, but also in low and middle income countries. And just, I think I want to just add to, as we kind of talk through the layers of complexity, that family doesn't necessarily mean nuclear family in a lot of the contexts where we are working. And, you know, from an anthropological perspective, thinking through what family actually looks like, who are taking over caretaking roles, what, you know, different structures look like when people are in the same household together and may not be family members or are linked with other households in ways that is conceptualized as family. It adds, I think, a level of complexity when we're talking both about measurement and when we're talking about what it means to build family and caregiving intervention. So I just kind of wanted to bring that into the conversation.
Absolutely. Paul, did you want to comment as well?
That's right. And I think it becomes even more interesting when you talked about the notion of power and how when it comes to women, it is empowerment, and when it comes to children, it's protection. But I think it is also important to think about building agency of children, the self-efficacy and agency, whether this is individual or actually collective. If you, like Lindsey said, if you are working in collectivistic societies where families are not nuclear, actually you might need to build the individual as well as collective agency and self-efficacy of children. So we need also to pay attention to that kind of perspective. Thank you.
Excellent. Lindsey, just to follow up on one of the comments you made as well, can you say a little bit more about perhaps interventions overall, not just related to the family, but overall that you think have been showing promise that perhaps weren't touched on in the review? And also, where are the places where you really feel like we need to learn more? You gave us an example already, but perhaps a few other places where you think we need to learn more. Thanks.
Sure. I mean, I think we all recognize here that there's so much learning that we still have to do in this space. So, you know, I think there's some nice examples of some new programming, and I think that will be featured in some of the future SVRI panels to come. But I think IRC's Safe at Home program is one that's sort of looking actually at the household unit. Andrea, who is here with us today, mentioned that WRC and Mercy Corps have been working on an intervention that does try to encompass a larger lens of the household. And I think the review makes this really excellent point too. If we're not measuring all of these different connections and looking at the ways that these different relationships play out, we're just missing huge chunks of what we really need to know and understand to program better. And I just, you know, wanted to say on the measurement front, I think a couple of Key biases have already been pointed out by Alessandra and other speakers, which are so important. I just wanted to add that, I think we talk a lot about what is the best way to get at data on intimate partner violence and the risks that come with that. And I think in a way we challenge less how we collect data on violence against children, especially when we're talking about young children, and we just kind of sort of take as a default that asking parents or caregivers is going to yield the best data. And we do have some learning from some of our previous studies using the neighborhood method that actually neighbors disclosed much higher rates of violence that were occurring against children in the household compared to what was happening in their own household. And so really thinking about social desirability bias, thinking about power and when you can and can't control some of the dynamics that are happening in one's household and the shame that may come with that, I think are really important and just remain, I think, bigger questions for us and areas for learning around the measurement piece as well.
Thanks, Lindsey. Lots of learning and I think areas to think about. I'm going to move over to a question to Paul, but I wanted to check in first and see whether Marcilen and Paul wanted to comment on that particular question as well. We're good? Okay.
Yeah, I just want to speak about measurement tools, especially when we are working with children. I think it is increasingly, there is evidence that use of vignettes, use of games, use of drawings can help children to express themselves. So if we integrate this within the in-depth interviews we conduct, or even the surveys we conduct, this seems to be quite helpful. Thank you.
Yeah, and Paul, let me follow up then with the question for you specifically. One of the things that has come up repeatedly is this idea of education, and education as a way of interrupting cycles of violence or protecting from violence. But we see that there are some kind of non-consistent findings around education for men and whether that interrupts violence, education for girls, for women, and the interruptions of violence. Can you say a little bit more around how you see the role of education in prevention and response of violence?
Yeah, I think that is quite interesting, that education is not working enough to change men. But I'm thinking that it is about the way the education is done, because in some cases, the school is one of the socialization agents, teachers are some of the socialization agents, but they tend to mirror the social norms that are within the community. So the mentoring of men to transform the harmful gender norms, the toxic masculinities, the hegemonic masculinity may not be happening within an education institution. So education could have impact, but we might need to transform the way we conduct this education. Thank you.
Excellent. Marcilen, can you, I'm going to go to you now and ask you to maybe say a little bit more about the comment you made at the beginning around really this integration of evidence at every level, from national to grassroots community. Can you say a little bit more around what are the ways in which you think we could really facilitate that kind of use of evidence at those various levels for the for work on the intersections of violence against children and violence against women?
Thanks, Daniela. I think what comes to mind with the question you've asked is the role that sponsors and policymakers have in terms of driving, whether it is research agendas or programs at national and grassroots level. And basically people end up working in ways that align sometimes to the funding mechanisms that are available and the priorities that have been set for example, by the funders and the sponsors. And therefore, I guess just as the SVRI is doing as a funder, it almost seems that there is a need for lobbying at such levels, people who set agendas, to be able to acknowledge these intersections so that even as resources are made available, there is that acknowledgement of life course approaches in terms of violence prevention. And once that, is set, it becomes much easier for people to organize and to think about programming in such ways. Thanks.
Thanks so much. Yeah, really good points. So I'm gonna ask you another question that's really related to, and I'll ask anyone to jump in. A couple of you have talked about different settings, and there are different settings when it comes to different contexts. We've heard quite a lot between the difference between the research that's out there for kind of upper income countries, low and middle income countries, those differences, cultural differences, but we haven't really touched a lot on the humanitarian kind of divide between development and humanitarian settings. So can someone, whoever wants to jump in and tell us a little bit about, are the same challenges similar for humanitarian settings, or are they different?
Thank you very much once again. I think this is a very important question that you are raising, and it is much more important right now, given that conflicts, armed conflicts and violence is increasing, leading to lots of humanitarian settings. I'll give an example of Uganda, which is among the largest refugee hosting country, and we see scenarios that are complex in humanitarian settings. On one hand, we have emergencies, humanitarian settings that qualify to be emergencies. Then we also have those that are protracted, that continue, and although they are being treated as emergencies, actually they are protracted. So the whole debate around the humanitarian aid development nexus has remained a debate, but in terms of programming, we don't see lots of changes, because most of the programs, the donor funds are for a very short duration, and yet most of the programs that should transform norms and structure factors need relatively long time. So that humanitarian aid development nexus, the heterogeneity of humanitarian settings, emergencies, and those that are protracted, that kind of context needs to be taken into account in designing prevention and response programs for VAW and VAR. Thank you.
Thank you, Paul.
And I'll jump in there as well to say that we conducted a similar systematic review looking at risk factors for violence against women and violence against children, specifically in humanitarian settings, and I can share that link, a number of years ago. And what I would say in terms of sort of the main takeaways in alongside the findings that have been shared today is that we know that conflict and political violence itself is a risk factor for increased IPV and violence in the home against children. And that overall we have less data on risk factors, but there are some similar ones that come out around alcohol and drug use, income, economic status, mental health coping strategies, and limited social support that are found in humanitarian settings to be shared drivers of both types of violence. But we also find more separate risk factors that are just targeting IPV or violence against children, which is interesting and may just be a product of there being fewer studies and less data, or there may be some further things to probe there as well.
Interesting. Thank you both. So I do want to open it up for questions from the audience, and we have quite a few, so that's awesome. People are excited and have lots of ideas they want to discuss. So before we do that, I just want to go to each one of you, and I wonder if you could, I hate it when people do this, but I think it's also very helpful to just kind of focus in. So if you could give us perhaps in 30 seconds, quick, like if there's one thing that you would recommend that we do as a field to ensure further collaboration and work around violence against children, violence against women, what would that be? So one recommendation, brief. Who would like to start?
I'm happy to start, Daniela. Sorry, are you talking about everyone or the panelists?
I was referring to the 3 panelists.
Oh,
but
okay, no.
Now you did it. You jumped in, so you have to tell me first.
I think something that jumps out at me from the review, because I work more on the response end, is to try and think about how we can get into that silo working and do more joined up working between prevention and response. I think that would be it for me.
Great. Anyone else can jump into, in addition to the 3?
Yeah, I think that we have to think about ethics of programming because we have a responsibility if there are shared risk factors and if the sites of violence are also shared, we have a responsibility ethically in terms of programming to make sure that we address the shared risk factors and we take into account the common sites of violence for children and for women. Because if we don't do that and we are programmers and we seek to being siloed, I think there is an ethical dilemma there in terms of programming. So it is an ethical issue, an ethical concern, if we keep ignoring, even when we know that there are shared risk factors and there are shared sites of violence, and actually that there are issues of safety and safeguarding that were raised by my colleagues that need to be taken into account both in the prevention and response. Thank you.
Thank you, Paul.
I would just add on to what Paul is saying in terms of our ethical responsibility and just reflecting on the settings where I work, which is in the low and middle income countries, where in any case we really have limited resources to be addressing violence, that it just makes sense for us to stop working in silos and where it is possible for us to work together, whether it is the interest groups who are in the VAC field or in the violence against women field, and leverage those resources, limited resources, in terms of addressing violence in a holistic manner, given that we've already identified that, you know, there are shared risk factors and the location of this violence is also shared.
Yeah, and I think that point, Marcilen, I mean, my experience has been that often when you go, especially in low and middle income countries, it's that same social worker, it's that same teacher, it's that same person who's going to have to deal with all of this anyway. And so the idea of, you know, maximizing limited resources, I think is an important one. Lindsey?
Yeah, I'll just share one very, very concrete suggestion that I think would help move our field forward, which is for any organization that is running a program to reduce violence against children or to prevent intimate partner violence, build into your M&E programs and your evaluation programs measurement of violence of other family members to help us begin to build the data to show the way that these relationships overlap, intersect, are mutually supported through these interventions, to show potential negative or positive unintended consequences. I love the story of the Real Fathers intervention in Uganda, which was really about parenting young new babies and had this unintended happy effect of also reducing IPV, which we only know because it got measured. So I think creating those opportunities for learning through the programming that is already happening would really go a long way for us.
Thank you, Lindsey. Excellent. So I'm going to open it up. We've asked people to put questions in the chat. Thank you, Liz, for summarizing some of those and sending them my way. And at this point, I did want to open up the questions to everyone who's presented. So it's not just the 3 panelists. And I'm just going to throw the questions out there and see who would like to respond. So the first question is from Patricia Hines. And her question is that they recently looked at some of the drivers of human trafficking and found consistently that children and adults were often leaving behind violent households, but then found themselves in an exploitative context afterwards. And has there been anything kind of in the literature that we've seen around those connections? So I think that brings in the issue of other forms of violence, like, for example, for children beyond child maltreatment in the home. And, kind of outside of that family setting, other kinds of violence that are actually related to IPV and child maltreatment. Do we have any evidence on that? Who would like to take that?
We may have identified a new area for further study. I'm not sure, Alessandra, you just turned on your camera if you have anything to add in that space.
No, I think that it's violence as a driver of trafficking or being exposed, higher risk of trafficking, or even migration. If you think about migration, that's something that I think we've known for a while. But it is true, Daniela, what you mentioned, whenever we are looking at the intersections of violence against women and violence against children, and even more narrowly, we look at intimate partner violence and violent discipline of children, we are very aware that there are other forms of violence that we need to be looking at. And I think, Paul, you mentioned, I can't remember now who mentioned, community level violence being a risk factor. Maybe it was you, Lindsey, for increased IPV and violence against children. Just to say, yes, we've known for a while that experiencing violence is a driver of migration or leaving the home in such a way that exposes your risk to trafficking, etc. And we need to do better about not just connecting violence against women and violence against children, but connecting with other forms of violence as well.
Yeah, could I add?
Yes, please, go ahead, Paul.
Yeah, and especially Alexandra, you talked about migration, and especially maybe forced migration, but let us take migration generally. We need also to look at the different phases of migration and the risk factors that they constitute. For example, during pre-departure, during transit, then during destination, and upon return. There are risk factors along the way. And people who are trafficked, children who are trafficked, and women and men go through all these risk factors, but we have not paid enough attention to this in research from this perspective of intersections between VAW and VAC. So I think it is a prime area for research. Thank you.
Yeah, thank you for that. I'm gonna jump into another question unless someone else wants to jump in. But I think the bottom line is clearly areas for additional research and looking at multiple forms of violence, but I think also other kinds of outcomes. And I'm trying to sift through the chat here related, for example, to homelessness and other issues as well that we haven't quite uncovered that then expose people to more violence, right? So it's like there are many pathways here. I think there's a question here, but I think, Alessandra, you addressed that already, this question about being able to, can we say authoritative? This is from Samuel Martin. I think that's the question you addressed, right? Can we say authoritatively whether, yes, abandoning harsh discipline towards children affects IPV? And I think you kind of touched on that. I don't know if there are any other people who want to jump in and say something around this idea of, do we really have enough evidence to say that by reducing child maltreatment, that actually does have a direct relationship with reduction of IPV, or the other way around? And I think that's kind of the evidence that was presented where it's somewhat conflicting at this point.
But can I say something, Daniela, which is sort of a different, sort of a slightly different take on the question? The evidence is pretty conclusive about the association between early exposure to violence and later perpetration or victimization of other forms of violence in adulthood, right? So logic would follow that if you're able to prevent early exposure to violence, that you would have an impact in preventing violence in adulthood. And then I think we were talking not only about intimate partner violence or sexual violence, but also other forms of violence, community violence. So although we may not have a longitudinal study that prevented violence in childhood and then went on to measure and show a reduction in later violence, I think that's where the idea of being grounded on the evidence that Marcilen, you mentioned, and on theories of change is really important. But for sure, early exposure to violence is the most consistent factor associated with perpetration and victimization.
Thank you, Alessandra. And I think that point around both perpetration and victimization is really important. And I know you've presented briefly here, but have other studies also around kind of these cycles, right? So we're talking about cycles where it's predictive of both perpetration and victimization, which is important. Excellent. Thank you for that clarification. Liz, I'm trying to sift through the questions and I need help because I'm trying to look through the chat and there's a lot. So if someone could perhaps put in if there are other questions or if other people want to jump in and comment, we have a few more minutes.
I think I've captured some of them, but please, participants, please recut and paste any additional questions you have or the ones that I have may have missed. But there's been some really great comments, Daniela, and lots of support, some recognition of the need for more evidence building, the importance of working in partnership, and lots and lots of people doing great work out there. So thank you for sharing all the work that you're doing.
So maybe with that, why don't I go ahead then, and I am seeing there are a lot of really good comments, and including comments around just being excited about the research. The issue of conflict has come up repeatedly, including in the DRC. So I think those are excellent. Why don't I take this opportunity then and ask the other speakers who didn't answer to give us their 30-second, if they would like. What is the one thing that you would recommend for this field to further advance collaboration?
Daniela, before we go there, there's a question from Mirko Fernandez, and I believe that Lindsey or Lorraine had wanted to answer it live.
Oh, great. I'm missing that. Okay, please go ahead if you can see it. I'm not sure I can.
Oh, no, I didn't. I was just reading it. I mean, I'll pass on to Lindsey first and add it.
Sure. Well, I'll just read the question, which is, how are victim survivors defining success for police intervention in cases of IPV or domestic violence? I imagine that arrest is not part of this vision of success for many women. I mean, I think this raises a really, really fundamental question, which is, what does survivor-centered definitions of success broadly look like for IPV? And so we've, talked a little bit from the evidence around psychological therapeutic interventions, economic interventions, but we haven't really talked that much about justice and the justice piece. I will say from actually some recent discussions around specifically conflict-related sexual violence, the evidence shows very little in the way of convictions being very important as a deterrent mechanism. That said, I think we broadly know that peace and security is a really important fundamental state for safety and security of individuals. But happy to have others jump in here as well.
Yeah, and Lindsey, it's interesting, some of the work we've been doing, Liz mentioned at the beginning around brave and survivor-centered experiences, and this idea of a framework that actually looks not just at prevention and response, because for a lot of survivors, that framework doesn't really fit, but more of a framework of prevention, healing, and justice. And this idea of healing as a long, journey, and also justice and the various forms that justice can take. And it doesn't look the same for everyone, and centering that experience, I think, like you're saying, for survivors is, I think, a really important thing for our field to be considering moving forward, around what does justice look like for survivors?
There's a question, Daniela, from Samuel Martin in the chat. If you're undertaking a project which has specific result focused on ending violence against children, how would one attempt to capture information about IPV, where someone might admit to harsh discipline against children, but would never admit to participating in IPV? In an environment where we have limited resources, should we not focus on the specific result we are seeking to change? It seems reasonable to think if you're focused on IPV that that should be the focus of that project exclusively.
Thank you, Liz. I appreciate that. Any reflections on that comment from Samuel?
Can I come in briefly, and then I would love to pass it on to Lindsey, because I think your example about real fathers is very apropos of this. But, you know, really, the evidence is also conclusive, and I don't use the word conclusive very often, but that children's exposure to intimate partner violence against their mothers has the same or worse negative effects than when children experience violence themselves. So let's say you have a project where you're trying to prevent violent discipline of children. Let's say you're successful about preventing violence discipline of children, but there's intimate partner violence going on in the home. You're not going to have the outcomes that you're hoping for. And that's, for instance, what has been found through parenting programs. If you're doing a parenting program where part of the outcomes that you expect is positive disciplining of children, but you haven't looked to see whether there's intimate partner violence against women occurring in the household, your impact is going to be diminished. So sometimes I say, let's say you don't care about violence against women, or let's say you don't care about violence against children, even if you're trying to reach a specific outcome, whether it's IPV or violence against children, if you're not looking at the other side, you're not going to be as effective as you could be. And I think the whole point in terms of the measurement piece is the missed opportunity, because you may be having these unintended effects that are very positive or not, but you won't know unless you're measuring it.
And maybe, sorry, Lindsey, before I pass it to you, I think it was also important to notice, in the mechanism of change, in the pathways of change in reduction of IPV and child maltreatment that Lorraine presented. And exactly like this indirect impact, and they were more obvious in the parenting programs that had more focus on reducing violent discipline and improving caregiver and children relationship. But then they had this indirect impact on reducing IPV and then therefore children exposure. So which was very interesting, because they kind of like teaching and for parents to learn some of the positive non-violent discipline mechanism also impacted on their relationship. So they started to apply this kind of non-violent conflict resolution also to the family, which had an impact indirectly to reduction of IPV. And so I think it's important, and maybe, yes, you might not want to focus just on I don't know, on IPV or just on children, but these are quite key elements that could actually maximize the reduction of both forms of violence, even if you focus on just one aspect or the other. And maybe one aspect, when you ask about the 30 minutes, Daniela, for me, it's also thinking about the theoretical approaches, because a lot of the theory of change is this intervention just focus on one form of violence, although they said they were combining both. And so very few were looking at the impact on both. And I think if we want to think about how to maximize and actually increase the reduction on both forms, is something to think about as well. So.
Excellent. Thank you, Manuela. Lindsey, you want to do a last comment here?
I don't feel the need to add into this space. I think this has been really great points by my two colleagues.
I see that there are more and more questions coming in. It's like people are warming up and there's a lot there to discuss. I'm also aware of the fact that we're at time. And I know, Liz, we wanted to hand it over back to you to wrap us up. Clearly, a lot more to think about, a lot more to discuss, but I did want to just take an opportunity to thank each and every one of our amazing panelists who are bringing such kind of creativity, thoughtfulness, and really basing, really trying to guide our field. I mean, you started, Alessandra, by saying there's been a lot of progress. There's been a lot of progress, but there's a lot more clearly for us to be doing. And you all really are at the cutting edge of that work. And so thank you for all that you're doing. And this is super important. And we're excited to be able to have this conversation with you. Over to Liz.
So we're coming to the end and the closing of our first webinar of one of three, as I've already mentioned. But before I formally close, I want to share the word cloud, which I hope everybody has had some opportunity to look at. Lisa, would you mind putting up the word cloud? And so Wow, I mean, look at all those words. Thank you very much. But what I see strongly coming out are shared measures, innovation, support. I need to just increase my screen. More effective services, acceleration. I love that word. Sharing of experiences, better understanding, solidarity, equity, knowledge sharing, joint solutions, synergy. Sharing ideas, increased funding. Let's hope it does that as well. We love that. I think that this has been incredibly, really useful at maximizing impact and complementing each other. So there seems to be a lot of positive words coming out to the question of working together, which is really important for us as well. I really want to thank you all for sharing your ideas and thought with us. And I really, on behalf of the IRC and the SVRI, I want to thank all the fabulous people who've made this event happen, to our producer, Liesel, to our translators, Estefania and Anur, all our speakers, Alessandra, Manuela, Isabel, Lorraine, Lindsay, Mercy, and Paul, and Heidi for your support. And to our wonderful chair, as always, Daniela, and of course, UNICEF Innocenti for co-hosting this with us today. Thank you. I'd also like to thank you all, our participants. You've been so wonderful, the engagement, the rich discussion, and reminding us that although we've gone far, there's so much more to do, and that we need more evidence, more knowledge building, more sharing of ideas, but we have to do this together. A big thanks to you, Kate and Danielle from the IRC, for being the big thinkers behind this process and this webinar series and bring us all together. Please do join us for webinar 2. It's going to be as awesome as this one was. We're going to put the invitation into the chat. It's going to be putting knowledge into practice. We're going to showcase some learnings from a trial outcome of a program model in humanitarian settings. So that is something to really look out for. And of course, join us for the SVRI Forum. Come share with us, come learn with us, come have more continuous, awesome discussions around these issues. And I've got one last request to all of you before you leave. We have a poll. Would you mind telling us how you found the webinar and help us learn to do this better? It's very short. There's 3 questions. So if you could just quickly fill in the evaluation, we would be super grateful. Unfortunately for the panelists, you're not able to vote. We're trying to manage the conflict of interest. So if you mind just taking 2 minutes to complete the evaluation for us, we really, really would be grateful. But again, thank you to everybody, and thank you to the participants, and thank you for those who aren't able to join us online, who will be listening to us virtually through the recording, which we will share to everybody that attended, and we'll put it all up online. Thank you again. Liesel, I think you can close the evaluation. Thank you. Thank you all. And to the next one.